More than 24 million Americans suffer from nerve damage, and it can happen at any age, though it's more common among older adults. Our next guest has developed his non-surgical, non-invasive, drug-free therapy to treat peripheral neuropathy. He's also the author of a new book. Dr. Aaron Gumm of Blueprint to Healthcare is here this morning to tell us more, along with his patient, Mickey Wheeler. Gentlemen, welcome to GMT. We appreciate you taking the time out to be here. Congratulations on the new book. You got to be excited about that.
I am very excited.
All right, let's talk about the symptoms of peripheral neuropathy.
You know,
what are they?
When patients have peripheral neuropathy, they experience burning pain, deep stabbing pain, numbness and tingling in the hands or feet. It's very debilitating, and when people get these type of symptoms, the drug cocktail approach and injection and invasive surgeries is just failing.
Oh, well, what exactly causes nerve damage?
There's a lot of things. 30% of nerve damage is from diabetes.
Okay.
The other part is from peripheral vascular disease, just wear and tear on the body. And when people just don't take care of their health for long periods of time, the nerves start breaking down.
Well, as I mentioned earlier, you have developed this non-invasive drug-free program to reverse nerve damage. What exactly does it involve?
You know, our program has some very cutting-edge technology that we use, from LED, infrared, laser technology. We use a machine that's actually used in all the cancer centers of America to treat neuropathy, because chemotherapy kills cancer, but it also kills nerves, so we use that same one.
So how does it actually reverse the nerve damage?
Well, let me give you an analogy.
Okay.
So if I were to cut my hand and need stitches, do the stitches heal my body, or does my body heal the cut?
Right.
So what that means said is the body heals the cut, not the stitches. So with neuropathy, we use that technology to put it in the right position for it to heal properly, just like the stitches do for the cut.
Very interesting. Mickey, let's talk to you. You experienced nerve damage firsthand. What were your symptoms?
The main symptoms to begin with were severe numbness, pain, some of the things that Dr. Gumm said. In the beginning, the worst part was the numbness. It had gotten so severe that I couldn't drive anymore because I couldn't feel the brake or the accelerator with my feet.
So how did you hear about this kind of treatment?
Actually, I'd seen an ad in the paper, and then I'd seen something on I think it was a card or a mailer that came to the house.
Well, thank goodness you did see that.
Right.
So what kind of drastic changes have you seen since starting this therapy?
Well, when I finally went in, at that point I couldn't sleep at night anymore because the pain was severe in my feet. And after 2 treatments, I was sleeping with socks on because my feet were so cold. After 2 treatments, I had no problem sleeping anymore at night.
Really?
I have not worn socks anymore to keep my feet warm. So that changed.
That's some great news. All right, so can you help everyone?
You know, that's a great question. We can't help everybody. There's going to be 5 to 10% of people that have just relied on that typical medical model, drugs, surgeries, injections, that just fail, and they've let their health deteriorate. But I'm an honest physician. I'm going to sit down with them and go through an evaluation and tell them if we can or can't help them.
Well, really quickly, you have a special offer for our viewers.
Yeah, the first 25 callers that call to come to one of our seminars will get a free copy of my book on Blueprint to Neuropathy. So they'll be able to come to the seminar and learn about what we do before we sit down with them.
Perfect. Gentlemen, thanks so much for coming in. And Mickey, so glad you're feeling a lot better. You can find out more by calling Blueprint to Healthcare at 972-427-3303 or go online at blueprinttohealthcare.com.